If you live in Germany or want to move to Germany, the German healthcare system can be hard to navigate. We have a dual healthcare system, which can be very confusing if you are not used to it. But I am here to help. You need to know some basic facts and you are ready to go. My name is Stefan Buntrock and I'm a board-certified urologist and sexologist. The first thing you need to know when you move to Germany is this. You are obliged to sign health insurance. It's the law. Our healthcare system is only in part funded by taxes. I am talking about infrastructure. But when it comes to health insurance, it's your turn to pay. Well, in reality, it equals taxation since it is compulsory and the rate is set by the government. At the moment, it's 14.6% of your gross income. Tax is such a bad word. We have a nicer one, Lohnnebenkosten. I think in German it sounds much better than additional wage costs. However, the good news is this. You only have to pay half of the amount because your employer will cover the other half. To whom are you paying? That's entirely up to you. You have the choice among 95 health insurance companies. We call them Krankenkasse. They will all cover your costs, so don't worry about that, but some may offer a little extra, like paying a share of your dental cleaning or covering homeopathic treatments. And then there is this hidden feature called gesetzlicher Zusatzbeitrag. Money is always tight, also in Germany, so the government has allowed them to charge you extra. This additional contribution varies a little from company to company. For 2024, it's 1.7%, but it could be as low as 1.2%. This is why it is advisable to compare companies. Your employer will also pay half of these additional charges. For the overwhelming majority of you, this will be it. You'll receive an electronic health card. If you are married and your partner is not employed, and if you have children, all of them will receive an electronic health card too, without having to pay extra for anyone. And they don't even have to reside in Germany. Their health expenses will be covered by the German healthcare system within the European Union, Norway, Iceland, Liechtenstein, Turkey, Bosnia-Herzegovina, Macedonia, Montenegro, and Serbia. There are some exceptions, but roughly that's how it works. If you need a doctor, you just book an appointment, take your health card with you, and everything will be taken care of. You don't pay extra for visits to the doctor. If you get a prescription, you will have to pay between 5 to 10 euros per medicine at the pharmacy. If you have to be treated in the hospital, you have to pay 10 euros per day, but only up to 28 days per calendar year. They won't charge you beyond this limit. In the beginning, I said that Germany has a dual system. We have a statutory system, which I just outlined. Besides the statutory system, there is private healthcare. Let's have a closer look at it. Approximately 10% of the population have private health insurance. Generally, only those who are self-employed, who are civil servants, and those with a gross income above 69,300 euros per year are eligible. In the statutory system, everybody contributes. If you get sick, the costs are covered from that money. If you never go to the doctor, doesn't matter, you have to pay. In private healthcare, you insure your personal risks. This is why monthly payments can vary between individuals. So if you already have an allergy or some kind of disease, it is even possible that insurance companies won't accept you as a client. Too risky for them. As a young person, when you usually are in good health, your monthly payments are ridiculously low. But with age, the monthly payments increase quite substantially. When you reach retirement, you pay on average approximately 1,000 euros per month right now. But this is just an estimate. As I said, you insure your personal risks. So private healthcare premiums can vary quite a bit. Unlike in the statutory system, in private insurance, every member of the family has to be paid for. And you also get billed for your appointments at the doctor and stays in the hospital. You have to pay these bills yourself, but you then get reimbursed by your insurance company, which is a little tricky sometimes because insurance companies might refuse payment for certain services. I won't go into detail here. I'm sure your question right now is, why? Why are there two types of health insurance in Germany? It's historic and dates back to the year 1883. It was the time of industrialization. Working conditions were disastrous, to put it mildly. There were strikes. The Social Democrats gained massive support. The working class was about to get out of control. At the same time, the industry needed the workers. So something needed to be done by the government not to run into a revolution. This was the start of the German social insurance system. It was initiated by Chancellor Otto von Bismarck. People with high income, craftsmen, business people, they all were left out. So this opened up a niche for private healthcare. There have been many attempts to unify these two branches and merge them into one national healthcare system, but it's complex, especially because in private healthcare, you pay a lot of money that they save for you when you get old. This money is your property. It can't be taken away from you. Anyway, nowadays, everybody in Germany can sign public health insurance. However, there are some differences between the two systems, and there may be advantages to stay in private healthcare. I will tell you about them in another video. Thanks for watching. Bye-bye.